Welcome. Thanks for joining us today. My name is Ann Stockman. I'm a registered nurse and a certified diabetes care and education specialist. I'm going to spend the next couple minutes with you talking and reviewing just about healthy living with diabetes. I'm going to share my screen with you, and that way you can follow along better. So here we go. You can still see me down in the corner. Okay, so we're going to talk a little bit about monitoring healthy eating, being active, taking medication, reducing risk, and healthy coping. When we talk about monitoring our glucose, I know a lot of times it seems to you that we talk all about what's your number, what's going on, your number, your A1C, your blood glucose. But it is important to help us find the right, to change your medications perhaps, or add new ones. So when we talk about glucose, how many times do you think your blood glucose could be different in 24 hours? Well, every minute could be different. That's like over 1,400 times a day your blood sugar would be different. We're not asking you to test your finger that many times. There's other things we can do. Like an A1C test is an average of your blood sugars over the last 3 months. That helps your doctor know where you are when we look at your big picture of diabetes. Now, some people test their blood sugar 1 to 8 times a day, depending on what information we need. Your blood glucose monitor can be very helpful in testing your blood sugar before you eat, and then 2 hours after you eat, and comparing those numbers. Also, you may have seen people with a continuous glucose monitoring, or CGM. You've probably seen it on TV where they wear it on their arm or in their stomach. Now that measures glucose and gives us a reading every 3 to 5 minutes. And we can look at time in range and also predict and catch before they have a low sugar reaction or if your sugar's on the rise. So those are things, if you're interested in, talk to your doctor about. Let's go on and talk about healthy eating. All of us have eaten the same way. We were raised different all our life. And diabetes and diabetes diet is really no different than a healthy diet for an adult. So when we look at healthy, we need to just look at my plate up here that has half the plate in green or non-starch vegetables. And then you have your protein and you have a little bit of your starch. So sometimes you just need to rearrange what's on your plate and make half of that a green again. When we go, if you look at reading labels, sometimes that can help you in the portion size. Because portion size, if you have a bowl of cereal, is it a little bowl or a big bowl? So portion size helps determine also, you can find that on the label, as to your serving versus the serving that's on the box itself. We also know as we get older, or even with the elderly, that sometimes you may not eat 3 meals a day anymore. You may snack all during the day, or maybe you have one big meal and then you have snacks to supplement. It's really important to let your doctor know really what your eating habits are, because if some meds are based on eating 3 meals a day. So we can adjust that if we know, and it could prevent some low blood sugar reactions if we're not reducing the insulin, if you're not eating as much anymore. Being active, keep moving. So in COVID, you might be inside more often. And so there are things you can do inside, like every commercial, get up and walk around your house, around your couch, or hold onto a chair and march. When you're sitting in front of the TV, pick up 2-pound weights, or you can take 2 cans of soup out of the cupboard and do some upper arm movements. Staying active and trying to get 150 minutes per week is what's recommended. Taking your medications. How many are you taking a day? How many times a day? This can be very overwhelming. But sometimes you do need with diabetes to take some pills and or non-injectable medicines and or insulin. So we need to talk about compliance with your medicines. Sometimes it's really difficult to take maybe your middle of the day pill. And so that can have an effect on your blood sugar. And you really need to be upfront with your provider and just say, you know, I'm having really hard taking all my meds. 3 times a day is too much. Some pills do come in time release, or with some of the insulins, if you were taking 4 shots a day to cover the meals. And at night, we might, if you're not eating 3 meals, we don't need to be taking insulin, or we can change it to maybe 2 shots a day versus 4. So there are a lot of options with taking your medications. But most important is if it's ordered, you need to take it like it's ordered. Otherwise, let us know how come or what's getting in the way of why you can't take it. Now, reducing risk. Reducing risk is really looking at preventing complications. We know the many complications of diabetes, and your doctor on an annual basis is checking your heart through either a EKG stress test, let's say every 5 years, or more often, it's doing your cholesterol levels and looking to see how that is. We know that diabetes can increase the risk of a heart attack or stroke, so we need to watch that. It's very important that you get out there and get your dilated eye exam. And we also monitor your kidney function. And the doctor can do that through a urine test at his office and sends it in, or blood work also for kidney function. Some of the things that are on here is you need to go to the dentist twice a year, keep that your gums healthy, and also we need to look at your feet and test your feet for sensation, or if you're able to feel. So your doctor might do that with a monofilament, or seeing if you feel. Now, if you have any burning or pain going up your legs or in your feet, let your doctor know. And you are entitled with diabetes to go to your podiatrist at least once a year. So keep track of these tests, watch your blood pressure, and let's prevent those complications with diabetes. Healthy coping. Now, this is a new word, this diabetes distress. And what does that mean? Diabetes distress is really feeling overwhelmed. Now, you've heard me talk about all these things you need to get done, and how many of you are feeling a little bit overwhelmed about doing all this. It's very hard to keep up on all the things you need to do for living healthy with diabetes. So we need to take it maybe smaller, and you need some help with an educator, a diabetes educator, to help you work out, how can I do this? What's most important to work on first? Talk to your doctor about this. And also healthy coping has to do with, with COVID nowadays, if you're cooped in and can't get to your loved ones, a lot of people get to feel depressed and isolated and lonely. It's real important to mention that to your doctor. And of course, with all the things you have to do with your diabetes, plus all these added things that you can't do now with COVID, there's might be a lot of stress in your life now, and we need to learn to talk to your doctor about that. Or can we lighten the load by helping you not feel so overwhelmed with taking care of your diabetes? So I want you all to be safe and take care of yourself and your diabetes. Let's hope this COVID thing goes away. If you are joining this virtual today, that tells me that you can still get a hold of your doctor and have a telehealth or a visit like this. So don't be afraid to stay in. Call your doctor and schedule an appointment. Keep getting your lab work done. And I wish you a healthy, safe out there. And thank you for taking these few minutes to view this.